Going to the doctor annually is really a good idea. We all know it, but we're busy. It's not always convenient. I'm Stephanie Erickson, and this is Wellness Wednesdays. I myself have to admit that I'm guilty of wondering if the annual checkups are even necessary. I mean, I feel fine, and I'm young-ish. What's the doctor even looking for anyway? Dr. Levine, emergency room physician and assistant professor at McGill University, recommends that we do have our annual checkups as a part of our overall well-being.
Starting at the age of 18, actually, people should get their blood pressure checked. It doesn't have to be every year, but that's when you should start. And then, especially in women, well, only in women, we do cervical cancer screening. So that means usually with a pap test, and that starts at 25. The main ones that sort of across the board, starting at 40, we should check are cholesterol and checking for diabetes. They're both blood tests, and they're both done starting at 40 and usually every couple of years. In addition to that, the only other thing I would say is blood pressure checks should start to be done annually. We start to do more regular cancer screenings in the 50s. So the ones that sort of start at 50 are breast cancer screening. Again, it depends if you have a family history, but breast cancer screening primarily with mammogram and colon cancer screening. And then there's other things. You want to talk to your doctor about prostate cancer screening as well. Basically, starting at 65, one of the things that is recommended that we screen for is osteoporosis in both men and women.
Of course, those individuals with medical conditions or having other risk factors should be seen more regularly. I know it's not always convenient, and it's certainly not always fun. But seeing your doctor regularly is a very important part of your overall health and well-being. In Montreal, Stephanie Erickson for Breakfast Television.